Hello, my name is Nilay Shah. I'm a preventive cardiologist and physician scientist whose research focuses on social and structural factors that influence health and health disparities, with particular interest in how cardiovascular health and disease are experienced by the diverse Asian populations of the United States. And I'm pleased to introduce and share our American Heart Association scientific statement titled Social Determinants of Cardiovascular Health in Asian Americans. I'd like to thank the American Heart Association for commissioning this work, highlighting the unique health experience of populations that remain underrepresented in clinical, community, population, and public health research. And I'd also like to thank our writing group members who have each have particular interest and expertise in social risk factors among Asian Americans, specifically, and in immigrant and minoritized populations more broadly. And in particular, I'd like to thank the vice chair of this statement, Dr. Stella Yi, who I will invite to introduce herself now as well.
Thank you, Nilay. Hi, everyone. I'm Stella Yi. I'm an associate professor at the NYU Grossman School of Medicine in the Department of Population Health in the section for health equity. And my research focuses on nutrition and cardiometabolic disease in Asian American and immigrant communities. And I'm really pleased to be here discussing our new statement, Nilay.
Yeah, I think that this is kind of a long time coming, but it's particularly exciting because I think the last decade has really shown a lot more data about the Asian American population, whereas perhaps before we didn't really have much information.
Yeah, I think that's true. And I think that for those of us that are in this space, a lot of the information, it's really nice to see it documented in one place because you kind of walk around with it in your head, and then once you have the opportunity to actually write it down and put it into a cohesive piece, it really comes together, and you realize, gosh, there is actually a lot of knowledge that we have. So I guess I'm curious to know, what was the major impetus for you and the rationale for writing this piece? Why social determinants of health and why Asian Americans?
Yeah, that's a great question. So the motivation to think about social determinants, particularly for the Asian American community and as they pertain to cardiovascular health and disease outcomes, really started by recognizing that the Asian American population is the fastest growing group in the United States, but it remains persistently underrepresented in health research. And for those of us who work in this space, we know that there's important diversity within the Asian population in the US, with many Asian origin groups that include people who identify as Chinese, Filipino, Indian, Korean, Japanese, and Vietnamese, which are the largest communities in the US, but there are many, many more that are even less well represented in the health-related literature. And we know from other work in other populations that there are a variety of upstream social and structural factors that contribute to health and disease. And work in this space has only really recently started to expand into better understand the differences in health status and health outcomes among Asian Americans. And so this statement came out of leading experts in the field. First, I think, as you alluded to be a signpost about the current state of the science for cardiovascular health and disparities experienced by US Asian populations. But one of the other motivations, I think, for putting together this statement was to adapt and establish a conceptual model that's based on the World Health Organization's model of social determinants of health that might help our understanding of how health and disease occurs in Asian American populations, but also guide future research and policies about how some of these upstream social factors might operate to influence cardiovascular health in Asian Americans.
Thank you for that background. I think to get into more specifics of it, what were some of the key findings that came out of doing this review?
So the first thing that I think is really important to highlight is that in this review that we put together, we made an active effort to recognize the heterogeneity of the Asian American population, which you and I and our colleagues who work in this space really put a lot of emphasis on, but may not be as well recognized. Population health research shows us that cardiovascular health and disease are not experienced in the same way across the diversity of individual Asian ethnic groups in the US. As you and I know, but others may not, historically, Asian populations in the US have been grouped into a single category that's been labeled Asian. And it's only in the last perhaps decade or so that we're starting to see health-related information be characterized in individual Asian ethnic groups. So our writing team made a concerted effort to present data from disaggregated groups, which is most commonly done by country of origin or ancestry, And there are instances where such data aren't available, but we tried to identify and prioritize original research sources that were in individual Asian ethnic groups rather than grouped into a singular category. So I think that's one of the first things that I would highlight about our narrative, is that we try to really pull together the current state of the science about social risk factors in disaggregated Asian groups. But the next thing I'll do is I'll point to our figure 1, which is our conceptual model of the social and structural determinants of cardiovascular health in Asian Americans, which we adapted from the WHO model. This is a guide for how we organize the scientific statement narrative. And I think it's particularly important because the factors that we included were deliberately included because there's specific evidence for their importance in leading to health status and health outcomes in the Asian American population. So if we take a look at the figure, we start on the left side of the figure at the broader level with things like understanding the social, economic, and political policies and contexts that lead to the opportunity for health or lead to disease across diverse Asian American populations. Things like labor policies, anti-discrimination policies, the policies related to food systems, as well as immigration-related factors, which I think are particularly important because the experience of immigration is really unique across multiple different US Asian populations, and the reasons for immigration are likely very different across these populations as well. And then as we follow this figure, we move towards more individual level factors, and then even further downstream, things like material circumstances and health behaviors related to cultural norms. But I think one of the biggest takeaways looking at this figure 1, we really tried to highlight in this work, is that there are a lot of complex and interrelated factors that likely lead to health and disease for the US Asian population. And it's really incumbent on not just us, but our colleagues in the research space to better understand what it is that really leads to health and leads to poor outcomes in health for diverse US Asian populations. And perhaps one of the biggest takeaways is that there's so much more work left to be done to understand the experience of some of these upstream social determinants and structural factors in health status.
Yeah, I really appreciated the overarching approach that you took in organizing this because, as you mentioned, you really highlighted a lot of social determinants of health that are unique to the Asian American experience. So I was wondering if you could comment on aspects that you think would be aligned with the general broader understanding of the Asian American cardiovascular health experience and other aspects that you hope and you think that people would find surprising when reading this.
So your question prompts me to think a lot about what data we have that are most robust about social determinants, and perhaps the one that maybe people are most familiar with is the role of socioeconomic position and how it influences health, not just in Asian American populations, but in the US population more broadly. We know socioeconomic position is a key social determinant, but perhaps what might surprise people as they read the statement is just how broad the distribution of socioeconomic position actually is in the Asian American population, which we show in figure number 2. Figure 2 is with data from the American Community Survey from 2017 to 2021, showing the distribution of educational attainment, health insurance coverage, and annual household income in a very diverse group of Asian American individuals. I think these data are particularly interesting because of this idea that you and I know of called the model minority myth, which is this stereotype that suggests that Asian American populations are very well resourced, highly educated, and tend to have better health status. And it's called a myth because I think that, in fact, is not necessarily true. Asian American populations, and especially the diversity of individual Asian groups, really span the spectrum of socioeconomic position. And so this is just one example, I think, of really highlighting just how broad the distribution of social risk factors like socioeconomic position are in the Asian American population. And we shouldn't paint this whole population as having a singular health advantage related to social determinants, when in fact there are individual Asian ethnic groups that are particularly socioeconomically disadvantaged. And what it really prompts me to think about is, what are we missing by kind of applying this stereotype to the Asian American population, the stereotype that the whole community at large is well resourced and advantaged, because it's just not true. And so if you read the statement, you'll get a sense of what we currently know about how socioeconomic status is experienced in diverse Asian groups and how it might influence the development of cardiovascular risk factors, but also where socioeconomic position poses a barrier to the opportunity for health in certain Asian populations in the U.S. And these populations that perhaps are at socioeconomic disadvantage are the ones for which we have the least data, and so there's so much more to understand in some of these individual Asian ethnic groups with respect to the role of social risk factors, including socioeconomic position.
Yeah, and I think just to dovetail on your comment about the model minority stereotype, honing in on the fact that the American Heart Association is so focused on structural racism and kind of tackling some of those the issues that are within that. The model minority myth constructed as a tool in terms of anti-blackness. So it's a tool that was constructed, and it's an artificially constructed stereotype about Asian Americans for which there's no empirical evidence, as a way to kind of create this division between Asians and blacks. And this happened in the 1960s when the model minority myth was coined. I did notice that the majority of the research that was coming out, that was cited, that was coming from MESA, which is great, and from Masala, which is also great, both NHLBI-funded studies that included Chinese and South Asian individuals. And then a lot of the other research, there were some community-based research articles, but then there are a number that are using administrative data, and you very rightfully point out within the narrative that a lot of these data that are generally collected in English and Spanish speakers only. So was that your overall impression too? Like I in terms of like the data sources, I didn't do like a deeper dive, but I do feel like number one, like the NIH funding really matters for creating this evidence. And then number two, the national data that we have still may be, it's great that we have it, but it still may be limited by English and Spanish limitations in terms of data collection. Do you have any reactions or thoughts to that?
Yeah, I think that's a really insightful observation, Stella, in the synthesis that we put together. While we do have the opportunity to understand health status in certain Asian populations through some of the cohort studies that may be familiar to many in the audience, like the MESA study and the Masala study, the evidence that we synthesized more often perhaps seems to be from really limited samples and in local communities. When we really drill down to individual level social risk factors, just because the phenotyping of diverse Asian populations has been limited to date. And then in parallel, as you allude to, some of the national level data is based on things like administrative coding, which have a lot of limitations in terms of biases that may be introduced with respect to identifying people of different Asian origins, or in terms of actually understanding health status in these groups. And so our data sources, I think, do limit a more broad understanding of what health status is and what disease status is in Asian ethnic populations in the US. It does, however, prompt me to think a little bit about what are some of the opportunities that are coming down the pipeline. As you know, and as perhaps many in the audience know, there's a newly funded cohort by the NIH called the Mosaic Study, which aims to enroll about 10,000 adults of both Asian American and Native Hawaiian and Pacific Islander communities in the US. It's a multi-center cohort that's funded by multiple centers through the NIH, and I think perhaps there's an opportunity here as we lay out a potential conceptual model for understanding the role of social risk factors in health status and outcomes in the Asian American population, to really guide some of the work that perhaps comes out of the Mosaic study, because this is a prospectively enrolling, newly developed cohort of Asian Americans dedicated to the health status of Asian Americans, which is not something that we've had access to before with respect to the health literature in the US.
Yeah, it's definitely historic and a long time coming in terms of advocacy for many of our academic partners and community partners. Is there a between the lines conclusion or realization that you made that you would want to share with the audience?
The real takeaway for me from this is the state of the science is actually quite a bit more detailed than we may have otherwise thought. As I was helping put together this narrative with our writing group, I realized that there's actually quite a bit more data about individual Asian communities and their cardiovascular health than I was anticipating. And But the real takeaway for me is where we still need to go. And that prompts me to point out the table that we have here in the statement, which is some of the key directions that we identified for future investigation to better understand some of the social risk factors and social determinants and upstream structural factors that may variably influence health status and disease outcomes in diverse Asian American populations. In this table, we try to think about social determinants and structural determinants in their various domains, and after having reviewed and synthesized a really large body of evidence for the statement, where do we still have to go? And there are several questions that we pose that remain to be evidence gaps for our understanding of health in the Asian American population. For me, that's really my key takeaway, is as much as we actually have learned about health status in the Asian American population through the excellent work in your research group and many of our colleagues, there's so much more left to learn if we really are to work towards achieving equity in cardiovascular health for Asian American populations and populations in the US more broadly. I'll ask you the same question.
So I think that one of the greatest takeaways of working on this piece was similar to you, it sharing that there is a lot more out there than we've realized. But I think also what I would hope that readers take away from this is, instead of thinking about like Asian American disparities, vis-a-vis other racial ethnic group disparities, such as like a better or worse kind of characterization or a subjective ranking kind of characterization, I really hope that readers take away from this the unique attributes of the Asian American experience and the fact that we just have a different experience than other groups. Not that it's better or worse, it's just different. And I think that even just that recognition, to have a seat at the table, for people to like recognize that the Asian American experience is unique in terms of immigration, in terms of the types of discrimination that are experienced, language access issues, which may or may not impact other communities. At the end of the day, they are our disparities and they are unique to us, and I think it's really important to treat that objectively rather than in relation to other groups. So
I think that's really well said, and so I hope that this narrative that we have published really helps spur some of that conversation among our research colleagues more broadly, spanning from clinical research at the individual level to community and population health research as well. And so I encourage anybody who's listening to this to take a moment and read this narrative. I think there's a lot that you'll learn about a population that perhaps you haven't seen as well represented in some of the research that you've read. I want to thank you, Stella, and our colleagues on the writing committee who put in a lot of time and effort and shared their expertise for putting together this narrative. And so on behalf of the writing committee, I wanted to say thank you, and I hope you find this valuable.